I'm joined now by Eric Arlia. He is the Senior Director of the System Pharmacy at Hartford HealthCare. Thank you for being with us.
Thank you for having me, Kara.
First, tell us a little bit more about what Remdesivir is.
Sure. So Remdesivir is an antiviral medication. It is the first antiviral medication that has shown to be effective against the COVID-19 virus. It's still in its early development stages, but the research that we have to date is very promising.
So I know the FDA just approved emergency use of this, but what is the criteria for you to give it to COVID-19 patients?
Sure. So the emergency use authorization gives us criteria for use. It's really intended mostly for patients that are pretty critically ill. It's an intravenous drug, so it's given by IV, so it's not a pill that someone would take at home. In general, patients have to have low oxygen levels. There's certain criteria that need to be met. They may or may not be intubated. It can be used before they're intubated as long as the oxygen level is at a certain point. We've developed some other criteria that we're using within our system more specifically to determine the best patients for our supply.
I know you just got the drug over the weekend for Hartford HealthCare. How did you distribute it quickly, and are you using it already?
Sure. So we had been waiting since May 1st when the news came out that Gilead was donating supply. So FEMA delivered the supply for the state of Connecticut on Saturday, and really want to credit the Department of Public Health and the Connecticut Hospital Association, working with all the hospitals in the state. They made the drug available to us all on Saturday afternoon. So we were able to secure our supply for Hartford HealthCare and distribute it to all of our hospitals in our system. And the first few patients did start getting therapy on Saturday evening. So we were, really proud of our entire state effort for really, as soon as the drug was available here, getting it to patients who may need it.
And quickly before I let you go, have you witnessed it really have a miraculous effect on some people?
So bear in mind, the studies that have come out so far really looked at reducing hospitalization time. And the ones that the approval came out on were reducing a typical 15-day down to about an 11-day. So we're not going to see an immediate miraculous effect. This is really just one drug of many different solutions, I think, that are going to long-term help us develop an effective treatment strategy for the disease. But we're hoping over the next week to 10 days to see if these patients start improving more quickly than we would have otherwise suspected.
Thank you so much for sharing the information. We look forward to hearing more.
Okay, thank you for having me.